Can a dentist reply to Google reviews? Ask 10 practice owners and you'll get 3 different answers. Some refuse to engage at all because they think AHPRA forbids it. Some reply to every review helpfully, including ones that mention treatment. And some have screenshots of 5-star reviews on their website homepage. All 3 approaches have problems. 2 of them carry real AHPRA risk. Let's clear it up. The relevant law is Section 133 of the Health Practitioner Regulation National Law. It prohibits using testimonials in advertising for any regulated health service. Dental, medical, all of it. The penalties are not theoretical. $60,000 per offence for an individual practitioner. $120,000 per offence for a body corporate, per offence. So the question of what counts as a testimonial, and what counts as advertising, becomes financially very specific. AHPRA has been working through this for years, and the current guidance is more nuanced than most dentists realise. AHPRA defines a testimonial as patient content used in your advertising. The key phrase is your advertising. That means content you publish or control, your website, your social media posts, your paid ads. Any platform where you choose what goes up. Reviews on third-party platforms, Google, Facebook, Whitecoat, TrueLocal, are a different category. You didn't publish those. You don't control them. They're not your advertising. So, they're not testimonials in the AHPRA sense. That's the foundation everything else builds on. Google reviews are particularly safe to engage with for one specific reason. You can't turn them off. There's no setting on a Google business profile that says disable reviews. They're going to appear whether you like it or not. AHPRA has acknowledged this in their testimonial tool guidance. Because reviews on platforms outside the practitioner's control aren't your advertising, engaging with them is treated as lower risk. Replying to a Google review is generally fine. Saying thanks for the kind words, see you next time. Acknowledging a complaint and offering to take it offline. That's the safer category. Facebook is a different conversation, because you can disable Facebook reviews and recommendations entirely. The setting exists. Which means AHPRA treats Facebook reviews as content you've chosen to allow on your platform. So they're treated as more under your control, and engaging with them carries more responsibility. Same goes for any other platform where you control whether reviews appear. If you have Facebook reviews enabled, the reviews and your replies are sitting there because you're letting them. That's a different risk category to Google. Now here's where most dentists get this slightly wrong, including me when I first read it. The actual AHPRA wording is not, you can freely respond to reviews. The actual wording from the AHPRA testimonial tool is, advertisers should take care if they choose to engage with reviews on third-party websites, as this may be considered using a testimonial to advertise a regulated health service. Take care, not free pass. The difference matters because if you respond carelessly, if you discuss clinical detail, if you confirm someone was a patient, if you encourage them to repeat their positive experience, you can convert a permissible reply into a problem. Care is the operative word. The safe responses are short, generic, and service level. For a 5-star review, a thanks for the kind words is fine. We appreciate you. See you next time. For a complaint, sorry to hear about your experience. Please email the practice manager so we can sort it out. Both of those acknowledge without engaging clinically. Both keep it brief. Both move any actual issue offline, where it belongs. None of them confirm the person is a patient, none discuss treatment, none claim outcomes. Here is the line you can't cross. Do not screenshot a positive review and post it on your own website, your own social media, or any of your ads. The moment you do that, you've taken an uncontrolled review and republished it on a platform you control. That converts the review into a testimonial in the AHPRA sense, and that's the breach. So no patient quotes on your homepage. No before and after captions sourced from review text. No Google review embed widget on your site. No this is what our patients say sections. No screenshots in your Facebook posts or Instagram reels. The reply on Google itself is fine. The screenshot of that reply on your homepage is a $60,000 problem. A few more lines that catch dentists out. Do not solicit reviews that mention specific treatments that gets close to a testimonial about clinical care. Do not offer incentives for positive reviews of any kind. Do not respond to a 1-star review by arguing about the patient's account of events. Do not confirm someone is a patient. Privacy obligations override the desire to defend yourself. If a review is factually inaccurate, you can correct it, but stay clinical content free and stay short. Recap. 4 things to remember. 1. Replying to Google reviews is allowed with care because it's a third-party platform you don't control. 2. Facebook reviews carry more responsibility because you can disable them. 3. Never republish reviews on any platform you do control. Your website, your socials, your ads. 4. Keep replies short, generic, and clinical content free. That's the entire framework. If you want me to audit your website and socials for review screenshots, embedded testimonial widgets, or any other published review content that would put you in breach, that's part of the free audit. aiadaptive.com.au/freeaudit. Specific to dental, AHPRA aware. Drop your URL and I'll flag anything that looks risky. The penalty is too big to guess about.